This is the KDA Video Minute for Friday, September 18th. Well, earlier this week on Monday, Mr. Pat Quinlan, the lobbyist for the Rhode Island Dental Association, was in Wichita for a presentation regarding the efforts of the Rhode Island Dental Association to pass some legislation in that state that so many of you have heard about and contacted the KDA office and officers that would limit or make it illegal for an insurance contract to cap uncovered services or non-covered services. Of course, that's a big issue this year right now. Delta has said that they were going to do that effective January 1 of 2010 here in the state of Kansas. And many of our members, of course, are very concerned about that particular issue. For more information about this issue, we have some information on the member side of our website. Mr. Pat Quinlan's 50-minute presentation is broken out into several different sections, so you can actually see that as he presented it. And then also I'll have a couple minutes where I'll talk about some strategy and some things that the KDA is doing. So please access that on the member side of our website as soon as you're done watching this video minute and to get more information on it. Of course, right now we're in the middle of our district meetings around the state. This year we have 10 district meetings that we'll be going to. Northeast District last year had voted to disband. Part of Northeast District is being merged into the 1st District, and the other part, the western part, is being merged into Topeka District. Both those districts are discussing that, and then in November, at the November 6th Board of Delegates meeting, the Board of Delegates will be taking that action to make that final, should that particular motion pass. So several district meetings are already completed. I think we're done with 6 of them already. An officer and a staff person has been and will continue to attend all those particular meetings. During those, Dr. Brett Roos or myself or whomever is talking about the different issues that are going on around the state. There is a report or a handout that's being presented. So if anybody would like more information on any of those things that we're discussing in the district meetings, or would like a copy of that particular publication that we're handing out, we'll make that available here on the website. So if you unfortunately missed your meeting, you can still find out what we've been talking about. So, and if we still have a meeting that you have not been to or we have not been to yet, we look forward to seeing you here in a couple weeks ahead. Of course, one of the main things that we're talking about with those district reports is that on August 21st, the practice of whitening by non-dental offices was ruled to be the practice of dentistry and therefore illegal by those non-dental offices. Now, getting that information out to those particular individuals or companies that might be doing that will be a lengthy process, so we certainly still expect to run into those types of services and kiosks and things. I heard earlier this week that at the state fair perhaps there was some of that going on. So if you run into any type of whitening going on in a mall or an activity, a festival, whatever it might be, please call the Kansas Dental Board so that they can contact those individuals or companies immediately and ask them to cease and desist. So we hope that over the next several months we'll be able to take care of that, and so that we can assure that the patients of the state of Kansas have safe experience with regard to their white. Also earlier this week, many of you may have seen that the Kansas Department of Health and Environment, the Bureau of Oral Health, issued their workforce study on dental. Many of you participated in that study over the spring, and the KDA frankly helped with putting that information together or trying to work with the Bureau of Oral Health so that they could gather more data. So that was put together, the report is final, and some information was released earlier in the week. What the report found, as many of you have read in the paper, is that in rural areas there aren't as many dentists and they're older. Well, that's not new information to us. Of course, the media has picked that up as being some grand information that needs to be, to scare everybody about the number of dentists around the state. We obviously are aware of that issue. That's why we've worked very hard over the last several years to try to come up with different ideas and concepts to try to get people out in rural areas. At the Kansas Dental Association, we spent a lot of time in trying to cultivate students to go to those areas. The Bureau of Oral Health has gotten some grant money this year over the next couple of years, and they intend to use that to help also further the efforts to get people out in rural Kansas. Now, with some of the discussion, the thing that we should be concerned about a little bit with the workforce study is we're starting to see some people here in our state start talking about mid-levels. And I know we've discussed mid-levels before. What's a mid-level? Is it a mid-level between a dentist and a hygienist? Is it someone that's, between a dental assistant and a dental hygienist? Of course, we have scaling assistants in our state, which is a type of mid-level. But right now the efforts, or the talk, is something along the lines of a dental health aid therapist, or something that Alaska has. I can tell you that Oral Health Kansas has formed a task force that is at the very much the ground level, looking at a very slow and deliberate process to determine whether or not a mid-level, or how a mid-level might work in our state. I can tell you that I'm a member of that task force. Dr. Mark Herzog, who is a member of the Oral Health Kansas Board of Delegates, or their board of directors, is also on that task force. There is some uncomfortable conversation. I'm not going to lie to you about that, but I think it's important for the Kansas Dental Association to be involved in those conversations, to provide input, and to see if we can keep any discussions like this in a favorable light with regard to dentistry. So just, it's important that the membership know that there is some discussion about this in the state of Kansas, and we're doing all we can to minimize what that impact might be, but we'll know more about that as the weeks and months progress. The Sunflower Showdown is fast approaching. That's our annual football tailgate, the KU K-State game. This year the football game's in Manhattan on Saturday, November 7th. Of course, we don't know when kickoff is. That's subject to determination by basically the Big 12 and the networks that televise those games. So we do have tickets available, and we still have some available. We'd like some people to participate. What we'll do is we'll have a tailgate in the Cattatown area of right outside the football stadium, and then we've got a block of 100 tickets for all of us to attend the football game. Now, if you already have a ticket to the football game, we encourage you to still sign up and attend the tailgate, and then use your own ticket and sit wherever your ticket might be. It'll be a good event. Prior to that, on Friday, November 6th, is the Board of Delegates meeting for the KDA, and we're going to have a short 1.5-hour CE session in the afternoon regarding some retirement and staff retirement plans and personal retirement plans, kind of where the market's going, some things like that. So we invite everyone, of course, to attend the tailgate, and we'd like to have you also, if you're interested, to contact us, and you can come Friday and do the CEV. Even if you're not on the Board of Delegates, we'd like to have you attend that free of charge if you're so inclined. And finally, 2 weeks from today begins the 150th annual session of the American Dental Association. Of course, there's a formal delegation of 10 Kansans that will be attending that, your House of Delegate Representatives to the ADA, the alternates, and then the Secretary will all be attending. So we're very excited about that. The ADA has quite a celebration planned during the annual session. So I know there are about 100 Kansans that will be at the ADA annual meeting, about 55, I think, dentists that I saw on the list. So there'll be a good delegation in Hawaii for the ADA meeting, and of course the celebration of the ADA. So we probably won't do a video minute for a couple weeks, and look forward to seeing you in Hawaii, those of you that are there, and have a good day.